Welcome to This Explainer. Let's just be honest for a second. If you are navigating the world of fertility, you already know it can feel like this complex, deeply personal maze. Today, we're going to decode the specific treatments offered at ART Fertility Clinics. Think of this as your reassuring, clear patient guide. We're taking all that intimidating medical speak and translating it into plain English. The goal? To make sure you walk away feeling confident, empowered, and fully informed about your options.
So what is the best path forward for your fertility journey? That is the million-dollar question, right? If you're feeling overwhelmed by the endless medical jargon, the alphabet soup of acronyms, and just generally anxious about your options, I want you to know right now that you are not alone in this. It is a totally normal way to feel. So take a deep breath and let's break this down together.
Here is our roadmap for today. First, we'll dive into the power of diagnosis. Second, we'll define your treatment options. And third, we're going to answer your biggest questions.
All right, Section 1, the power of diagnosis.
Listen to this approach from Dr. Fatemi, one of the leading experts over at ART Fertility Clinics. He says after the anamnesis of the couple and their subsequent screening and tests to determine the cause of infertility, we have the diagnosis, which allows us to explore treatment options. What I love about this is the incredible level of reassurance it provides. You know you're in expert hands right from the start, beginning with a super thorough evaluation before any treatments are even on the table.
Now, he mentioned anamnesis. Please don't let that clinical word intimidate you. In the medical world, anamnesis literally just means a patient's medical history. It means your doctor is sitting down, taking the time to actually listen, and learning about your unique background before anything physical begins. This isn't some rushed 5-minute intake. It's the complete story of your health, and it forms the crucial foundation of your entire care plan.
And here is why that matters so much. Once the exact cause is diagnosed, chances of a successful pregnancy increase dramatically. This customized screening isn't just routine paperwork. Pinpointing the exact underlying cause completely removes the guesswork. You're replacing uncertainty with precise, targeted science. And honestly, when you're dealing with something as profound as building a family, that kind of scientific clarity is incredibly empowering.
Okay, let's move right along to Section 2, defining your treatment options.
Think of ART Fertility Clinics as having a comprehensive, highly specialized toolkit. There are 3 main categories of treatments available to you. At the foundational level, we have medications, which are often just used to stimulate ovulation. Moving up a step, we have IUI, that's intrauterine insemination. And finally, assisted reproductive technologies, or ART, which includes advanced procedures like IVF and ICSI. Having this tiered approach means there's an option perfectly matched to whatever that initial diagnosis reveals. Let's gently unpack a few of these acronyms, starting with COH, or Controlled Ovarian Hyperstimulation. I know, it sounds incredibly complex, but it's really just a treatment designed to help your body safely develop multiple eggs, or ovarian follicles, rather than just the single normal egg you would produce in a standard cycle. It basically gives your body a highly monitored, safe little boost.
Then there's IVM, which stands for in vitro maturation. This is a brilliant, specialized process where a woman's eggs are safely collected slightly earlier in their natural cycle and then actually finish maturing outside the body in a lab. It's truly a marvel of modern medicine, offering an amazing pathway for patients whose unique medical background might make standard stimulation less than ideal. For more complex cases, the most successful and well-known option is IVF, or in vitro fertilization. IVF is incredibly precise because fertilization happens in a highly controlled lab setting. This lets the medical team meticulously monitor the embryo's development, watching it grow day by day before carefully transferring it to the uterus. It's this delicate, beautiful blend of nature and advanced science.
But with all these advanced procedures, perhaps the absolute most reassuring fact we can share is this: there is no single best treatment for all women. Your path is 100% customized to you. Whether it turns out to be ICSI, IVF, or just simple medications, there's no one-size-fits-all answer here. The best treatment depends entirely on your specific diagnosis. You aren't being pushed through a factory line. You're getting a bespoke medical plan.
All right, Section 3, answering your biggest questions.
So, how long does fertility treatment actually take? This is hands down one of the most common and totally understandable questions patients ask. When you're trying to plan your life, your career, and your emotional bandwidth around a medical journey, you really need a clear timeline, right?
Well, the timeline varies heavily based on your customized plan. A simple treatment, like ovulation meds, might wrap up in just one single menstrual cycle. However, an IVF cycle requires a bigger commitment, usually about 4 to 6 weeks.
And keep in mind, some patients might need multiple cycles depending on how their unique body responds. Knowing these timeframes up front really helps you mentally and logistically prepare.
You might also be wondering, what can I do to improve female fertility? When you're sitting in a doctor's office, it's so incredibly easy to feel like a passive passenger. You're just absorbing facts, and it can feel like everything is out of your hands. But you probably want to know what role you play and how you can actively help the process along.
The good news? Alongside your clinical treatment, you have real power here. First, work with your clinic to identify the underlying cause. Then, maintain a healthy lifestyle, actively manage your weight, and find meaningful ways to consciously reduce your stress. And of course, diligently follow your medical advice. These are empowering, active steps you can take today to build the strongest possible foundation for your treatments.
Because ultimately, timely evaluation and appropriate treatment greatly increase your chances of pregnancy. Time truly is a crucial factor. Seeking out that initial evaluation from the clinic is literally your strongest asset. It sets the whole thing into motion and transforms all that uncertainty into a concrete, actionable plan.
As we wrap up this explainer, I want to leave you with an empowering thought. What is one simple, positive lifestyle step you can take today to reduce your stress as you prep to book your appointment? Whether it's taking a quiet walk or just giving yourself a little grace, prioritize your well-being. You have the tools, you have the roadmap, and whenever you're ready, you now know exactly what to expect. Take a deep breath. You've totally got this.